Bonjour, bienvenue.
Good afternoon, ladies and gentlemen. Thank you for being here. I'd like to thank all these speakers. Health or economics, the impossible dilemma. This is the question that we would like to raise. It's a question that has been prevalent during the whole year. We'll try to answer this question with all our guests. For those who are following us remotely, there will be a Q&A session after the speakers have taken the floor. You will be given the floor. Natasha Valla, member of the Cercle des Économistes, she will introduce the session to all of you. So good afternoon, ladies and gentlemen. Thank you for being with us today. So in person or behind your screen, there will be a session on health. There's a link with the previous session. How can we make sure that health systems are prepared for future epidemics? So we'll be talking about the link, the symbiotic relations between economic development and management of health crisis. And this is a topic that is uppermost in the minds of people. Our personal and professional lives have been turned upside down in the past 2 years because of the COVID crisis. But we need to move away from the daily management and the immediate responses that were provided, especially if you consider the public policies and economic policies. I would like to moot three ideas. I'm short of time, so I will throw up three ideas. The first idea or first dimension, it is something that has had an impact on me. I'm working at a Sciences Politique school. I'm exposed to young generations, and there was a sort of opposition amongst generations. So we sacrifice young people in order to preserve the health of old citizens. Illegitimate constraints are placed upon a new generation for healthy gains or for health gains that are uncertain. So allow me to analyze this situation, taking into account the benefit of time. So there's a chasm between generations. Is it something that is inexorable? Second idea. So have a look at the title. I would like to challenge the title. So health for economics, an impossible dilemma. Is it really a dilemma? So can we say one day, with the benefit of hindsight, and if you take into account what has been done in terms of collective attitudes and public policies, adaptation of public players, companies were very agile in their organization, in their work organization. Improvements were made because of a crisis. So if you consider all the impact and effects of the crisis, maybe we have sown the seeds of productivity gains for the future by expediting some adjustments, by fast-tracking some elements. Of course, it's an endogenous approach, but because of these endogenous factors, I think that we should raise this question between health and economy. What are the lessons that we can draw? If you consider public policy funding, research in health, we have some guests who are well placed to talk about that. The people mobilize themselves. Public funds have been mobilized and raised for research and development. And in France and in other sectors and in other countries, so I could mention iconic examples, but gene therapy. At the end of the day, even though a lot of public money has been put on the table, it was very difficult to make sure that our companies grow in terms of basic and fundamental research. It was very difficult to come up with genuine tools, scalable tools. with an industrial potential. So I will leave it there because my speaking time is over, and I hand over to our moderator. Thank you, Natasha. Thank you for these avenues. We'll try and answer all these questions. First guest, I think that you know him. He was in the media very often. Professor Arnaud Fontane, epidemiologist at the Pasteur Institute. So I will ask him the first question. As Natasha pointed out, health or economics, is it a dilemma? Can we say that these two terms are antinomic? Are they mutually exclusive? So, Mr. Fontane, do we have to choose between health and economics? This is something that we were during the crisis. Good afternoon. Thank you for inviting me. I'm delighted to be with you today. And unfortunately, I'm not with you, but I'm very happy, nonetheless, to be with you. For me, there is no antagonism between health and economics. Health and economics are intermingled. They go hand in hand. There are some figures that will bear witness to that trend. The Financial Times has published some graphs whereby the countries that have better resisted to the epidemic with the lower health impact are those countries which economically had done a good job, and the drop in GDP was very low in those countries. So this is an observation that we can make. So how can we explain that? There's something that we need to understand. With this epidemic, when you know that you will get a spike in the epidemic because it is winter or because you have a new variant. I mean, we had the British English variant at the start of the year. It is important, imperious, to take measures immediately instead of procrastinating. You cannot allow the health situation to deteriorate because you know that these measures will have to be taken at a given point in time. But in fact, you will be catching up. And at the end of the day, you will take the same measures that you would have had to take in order to prevent the health crisis. So, back to the reproduction rate, the number of secondary cases per people infected. For us to control an epidemic, it should be 1 or below 1. Each person who is infected should infect less than 1 if we want the epidemic to decline. If there's a plateau, the reproduction rate will be 1. But restriction measures have to be taken in order to maintain the reproduction rate to 1. It is exactly the same whether you have 30,000 cases a day or 3,000 cases a day. And once you've understood that dimension, the measures will be the same, whatever the propagation level of the virus. If you are in a plateau situation, there's an obvious question. So what will be the gain of having 3,000 cases a day instead of having 3,000 cases a day? No gain. So the idea is to get to a plateau, to have a plateau situation with the reproduction rate at 1 with the same restriction measures, but this should happen at the start. When you think that you won't be able to control the epidemic because of winter, because there's a new variant that is more transmissible, it's better to take measures immediately. This is what Germany did, Denmark did, and for Europe, these countries had a good health situation and a better economic situation. So today, we have the Indian variant. The Indian variant is much more transmissible, and we could say that there would be a spike in the epidemic because of the Indian variant. Maybe we should take some measures. I would have said yes without vaccination. If we take measures, it's because we don't want to overwhelm the hospitals, because we will have to have an epidemic peak that is acceptable. We lost the connection. Sorry. So, if you consider the Indian variant, there might be an increase in number of cases, but the number of people going to hospitals will be reduced because of the vaccination programs. So for us, last September, or in January, we wanted to take early measures, to propose early measures to prevent the rise in the epidemic, because we knew that intensive care units would be overwhelmed. But with the Indian variant, the situation is different because of vaccination. Of course, the virus will continue to circulate, but let's have a look at what is happening in Portugal, Israel, in the UK. In these countries, there's a spike in the Indian variants. So if there is an increasing number of people who are ill, but if hospitals are not overwhelmed, that's okay. But if hospitals are overwhelmed, I think that we need to take some measures. Thank you. This is the main message that I wanted to deliver to you. So thank you, Mr. Fontanet. Perfect. Catherine Trouvé, you are the head of Harmonie Mutuelle. Lessons from this crisis. What are the lessons that you've drawn from this crisis? Catherine, so we are an operator, supplementary health operator. We protect 11 million people, providing health coverage to people. So when I looked at the question, I thought that we tried to save lives, and health or economics were secondary. We tried to save lives first. And there were new risks on health for the future. Have in mind mental health, people being overweight, obesity. There are some surveys about obesity affecting children. So health is global, and it is different to care. We say that care represents 10% of what is being done in health, and the remaining 90% are the health determinants, the way you live, etc. And then there's another idea, preventive medicine and cure. So these two aspects were very important during this period. During the opening conference, we talked about the state, companies, and civil society. Companies, businesses were affected. And all together, we realized that a company can bring about some health problems, but also some solutions. A health territory, performance and health go hand in hand. They are intermingled. So the cost of absenteeism is worth 100 million, but it is true that absenteeism has increased by 1%. People are out of work because of an accident, because of a disease of the employee, and for the two-thirds of people who are out of work, it's because the children are ill, or mismanagement, or bad jobs and burnout problems. So we can say that the organization of a company is pivotal in terms of health. We can also talk about inclusiveness. So during the COVID, there were other issues to deal with, chronic diseases. So faced with different situations, We know that 20% of the population is affected by a chronic disease. The health crisis also uh, has given a new dimension to the first aid workers, especially if you consider the laws that are enacted in France. There's another point that I would like to highlight. Civil society, inclusion, social bonds, networks of solidarity are pivotal. They play a key role in terms of health. Christine Lagarde has talked about shaping society, shaping a society. Most of the time, this is a term that is being used by supplementary health organizations in terms of mental health, time, tension, security, the sense of belonging to a network, to a community is pivotal. And these are some beliefs that we've had for quite a long time. So we've drawn up an assessment. So the health of people, the health of society, these topics are intermingled. Of course, beyond health and economics, there's a virtuous circle. We could talk about extra financial, extra economic matters, something that we could value, but we don't take these dimensions into account. Jules Baudet talked about that during the inaugural conference, the local aspect, the territories, all these networks that really make a difference. Thank you. Didier Baizoki, you are the head of MMA, so dealing with insurance, solidarity. You are well placed that health is not a resource like any other resource. What are the lessons that you've drawn? Maybe we need to rethink your vision, to revisit your approach, this dilemma. Good afternoon. Above all, we are an insurance company for private citizens, for companies, in order to protect them against industrial risks, civil accountability, civil responsibility. The people who were insured wanted some help. We helped 63,000 companies, so we earmarked 230 million euros worth of aid to all these companies. And so, in fact, companies, civil society players play a key role. As it was said earlier, they have made a lot of efforts. The whole society has made some effort in order to combat this scourge. We were surprised by this scourge because, once again, we've noticed that we were in a risky society. We thought that we were in a risk-free society. And health is a common good. We've noticed that with the pandemic, that health is a common good. But what is at stake now is to know what can we do. The state has done a good job. The state was involved in order to help people, in order to help companies. The question that we need to raise now, and before the advent of a new pandemic, what are the funding mechanisms, the organization mechanisms that will enable us to get a good balance between what is necessary. National solidarity is linked with confidence, and the freedom in terms of economics. So there are some figures that I would like to highlight. When we talk about health or economics, an impossible dilemma, health is a key part in our economics. 18% of GDP in France, 11% in In the UK, 9% in Spain. So these are important elements. So health economics is a key aspect to our economy or in our economy. So the question that will be raised, and our collective systems based on solidarity are under pressure. Aging population, new therapies coming to the fore. And our colleagues will talk about gene therapy. And people want to live in a more comfortable way. In France, the redistribution rate is quite high. In France, the public system will cover 78% of expenses. We are one of the countries where the family's contribution to health is amongst the lowest. So, of course, if you put more public money, it doesn't mean that we will sort out some problems. We need to better use public money. So what about the role of the public system, the solidarity that is key? And this is the case in many European countries. And if you consider Medicaid or Medicare expenses, health expenses account for 40%. So I think that we need to free up some energies. There are some significant investment needs in technology. So it's important for some people to get access to care, to health. We know that some people were deprived of health care in some isolated regions. So what about the system, the sustainability of the system? Of course, civil life has to play its role through the protection systems in the companies. The households have a role to play, and the regions also have a role to play. Very often we talk about regions. It's important to talk about regions because at a regional level you have a better contact with the tangible situations with people so that it's possible to detect shortcomings in healthcare and to raise some funds that could be tailored to the needs and requirements of the population in order to cover the essential needs of people. So during the crisis, we managed to cope with the situation with debts, but there will be some emerging tensions in the funding systems. There are also some inequalities in our countries regarding access to health. All of these questions and issues should be raised. The state, the regions, the companies, the professional branches and divisions all have a role to play. We need to come up with a different approach in order to free up some energies and to beef up innovation, because innovation, whether it is organizational or support therapy, is lacking. But we'll have time to talk about that at a later stage. Thank you, Mr. Bazoki. We have two guests that will enable us to expand our discussions to a European level. Salvador Illa, he was the health minister in Spain until January, and I would like to ask him, what can you tell me about the choices that you've made when you were at the helm? If I'm not mistaken, there was a first lockdown that was very strict, and last spring Spain chose a different approach, a less strict approach to that of other countries in Europe. So what are the lessons that you've drawn from your experience with the government?
So in Spain, right from the beginning, we took three decisive decisions to deal with COVID-19. The first choice was to follow science, therefore a scientific approach. and to work closely with our specialist epidemiologists in order and follow their recommendations. The second choice was to really engage in an approach for health in order to save lives and take all decisions within an institutional framework in order to save the lives of our citizens. The third choice was to be extremely transparent and to explain the information that we had, why we were doing things, and why we were taking these decisions. When we gained additional information, we had the opportunity of maintaining our decisions, and we decided to adopt restrictions that were less strict for the population. We had a very, very stringent lockdown, and Spanish citizens really followed our recommendations and very closely. The Spanish population was exemplary in this respect. After that stage of severe lockdown, we adopted a more federal approach because the health system is highly decentralized in Spain. And we needed to recognize the role of autonomous regions in Spain. And we had a federal approach. And we always followed the recommendations of our scientists. From my point of view, there is no dilemma between health and economy, because without health, there is no economy. And on the other hand, the economy is a very important aspect of health. Rich countries are favored as compared to poor countries in this respect. So we tried to take the right decisions whilst respecting business. A minimum amount of business is necessary, of economic activity is necessary, even for public health systems to operate and to have subsistence products. So as the opportunity arose, we tried to lighten the measures of lockdown in order to allow the economy to revive. In Spain and in Europe, we've had the figures of COVID-19, but we've had the figures, and at March, April, May, the figures are going down. There's a clear downward trend. And thanks to the vaccination and the European approach, which was very successful, I believe, more than half of the population of Spain has been vaccinated with their first dose, and almost 40% of the population have already had their 2 doses. Therefore, we are setting the economy back on its feet now. But we're very cautious, and a large part of the Spanish population below the age of 40 years have not yet had access to the vaccination. So what was very important for us was the scientific approach, explaining to citizens the reasons why these decisions were made, and the objective is to save the lives of our fellow Spanish citizens. Thank you, Salvador Ira. José Vieira da Silva was also a former Minister of Labour in Portugal. You are also director of the Res Publica Foundation. For you, could you also share your thoughts with us as to the experience of Portugal in the impossible arbitration between health and the economy? Hello, and thank you for inviting me to speak to you. I think that it's important to recall the nature of the crisis that we're experiencing currently. It is a very new kind of crisis, a different kind of crisis. It is a crisis which has a direct impact on markets. It is a global pandemic that has spread like wildfire. It is a crisis that has a dimension since the very first months. Most of the countries, in particular in the European Union, decided to implement social distancing. And this aggravated the economic crisis. But I think the critical point is to try to gain time in order to develop a stronger response, a more effective response. And to create the conditions for an economic revival. I believe that the differences in policy between different countries are not just related to health, but they're also related to the economy, regarding the management of social life. We can't only take into account the dynamics of health, because there's also an eminently practical question. And we need to try to ensure that there is not a destructive massive of competences and skills that are destroyed by this crisis. We are still in a very precarious equilibrium, and today it is indisputable that we are very far from having the health, economic, and social world of the post-COVID. The dynamics, the increasing circulation of the virus, the challenge of the vaccination have affected economic regulation at a national and regional level, and this will continue for some time, because most of the countries remain at threat of a partial return of the pandemic. A very important question is, how can we manage this uncertainty? I think that we must concentrate on the future. Economic cooperation is developing, whereas the pandemic is far from being over across the world. So we need to be very clear in the European Union. We must reinvest in Europe with a very strong signal of investment in health services, but also social services that have been strongly affected by the crisis. And we need to really pay attention to this educational systems. And we need to achieve the transition with new technologies. So we also face social crises and employment crises in different regions. So we must reinforce the capacity of the European Union. That is a critical point. in order to have a balanced approach and a European strategy that is not too pessimistic, but which does enhance the question of our autonomy. So I think that the conflict between health and economy is not new, but rather a step back to the old question of social priorities and those of the market. So there's a question of common interest and economic interest. We must place a priority on the preservation of the efficiency of systems. This is not always intuitive. It requires a balanced, transparent management. It is not an easy task. Thank you. Thank you, José da Silva. Paul Achan, you're General Director of Sanofi. We were waiting for the vaccine, and it will soon be on the market. You're going to tell us about this, but can you already answer, in your own words, to the question that we're reviewing today, the dilemma between health and the economy? For a large group such as yours, have you also learnt from this crisis?
Well, thank you, and thank you for the invitation. We've learned a great deal as a company. Maybe a quick comment about our own vaccine. While we were delayed 5 months in the development to make sure that our safety and efficacy was perfect, and you've seen what happens as people start to choose between vaccines, we know full well we'll be here by the end of the year and will play a very important role as your third shot. So most of you, I think, are already aware that the 2 shots get you started. There'll be another shot at the end of the year or the beginning of next year. We hope then that carries you through 2022, potentially into 23. We think this will be around through 24 in patches. This meeting wouldn't take place without vaccines. If there weren't vaccines, I think we'd be entirely virtual. We'd be back at Aix-en-Seine, where I was last year, not quite as pretty or as hot. I think the challenge for all of us is a real one. It's never been health or economy. It's never really been discussed. In the pandemic, it was clear, and people, my own families, would step forward and say, when is the vaccine coming? What are we doing? We need to get back to normal. And the question became very real, and it became every day for everybody. The relaxing of restrictions to try and get economies going was only really enabled by the prospect of vaccines. And as vaccines have come, and as the industry has done things in 12 and 24 months, what normally takes 10 years, we're able to get that R number down, and we're able to start thinking about, okay, cases are up, but deaths are flat or declining. And that's critically important, particularly if you're in a purpose-driven company like we are. But it's been going on for years, and my 32 years in the industry, health or economy has been an everyday question. 50% of newborn babies that are admitted to intensive care in the United States are admitted in respiratory distress. There is actually a treatment to prevent that, but paying to prevent disease is seen as a cost that not every society wants to bear. Prevention is now becoming much more relevant given the pandemic, but every day, everywhere we see this. 500,000 people die of influenza every year. 11,000 of those are here in France. Vaccines are less than 10 euros in many cases to deal with that. Somebody has to make a choice for that to be available. Patients have to be motivated to want to do something to protect themselves. Population health management is the new battle, and we think after the pandemic that the level of understanding is incredible, and that we have a chance to do something about protecting the lives of many. After clean water, vaccines are the #1 giver to population health. So we think the attitudes will change. Leading up to the pandemic, we just heard from 2 ministers of health, or ex-ministers of health, most of the ministers would say to me, we have shortages of chronic medicines because those medicines have been offshored, the purchase of them to China and India. And during the pandemic, they were not available. They were not being exported. The active ingredients for those medicines was depriving Europe. Whilst we waited for a vaccine, many people couldn't get a blood pressure lowering medicine. We need to make sure there's health sovereignty in Europe, and we need to make sure that governments understand the importance of long-term thinking in health management and making sure medicines are available in the region. We're floating a company to do just that, but it began with the idea that it was simply unacceptable that medicines were not available. And then after that, and importantly, the collaboration that we're learning between health and economy. The number of calls every weekend that I've been on over the past year with the President of the European Union, President Macron, Chancellor Merkel, everybody, has been, what can we do? How can we manage? How can we collaborate? How do we bring the EMA or the MHRA to the table to get medicines available, even if not approved, to treat COVID? And we step forward in a spirit of collaboration. I was speaking to a young group earlier. Out of the 10 years to invent and approve a new medicine, 3 years is waiting for a reply from the FDA or the EMA. Simply waiting for a reply. So you think about that. In the pandemic, that disappeared. Replies came immediately. Our aspiration is that that urgency is kept and that we live to bring that urgency to pancreatic cancer, to other diseases where there is unmet need. Why should we take 10 years? Simply unforgivable. And then lastly, public-private partnership, industry, academia, what we've seen, whether it's a university and the different things that we've done, have been incredible, real-time, breathtaking. For us here in France in particular, we aim, for example, to come together, and President Macron revealed this on Tuesday at Health 2030 at the Elysee. We'll bring together the IGR, the Institut Gustave-Roussy, Sanofi, the Paris-Saclay, the Polytechnique, to start bringing computational science to advance new cures faster. We need policy change. I think France may lead the way ultimately in that. But we need collaboration to remain, and we do need everybody to maintain the urgency, because when everything returns to normal, we have to remember how many lost lives, what could we have done differently, and how can that urgency bring to innovation and to make sure that Europe in particular has health sovereignty and that we don't make a trade between economy and health.
Thank you. Merci, Paul Hudson. On a encore quelques minutes. Si vous avez des questions.
We have a few moments. If you have any questions, then please do raise your hands. We must be quick. If you have several questions, we'll take the questions. There are 2 questions. We'll take those together because you don't have a lot of time. Hello. Thank you very much to everybody for your very interesting interventions. I have a question. The fact that a healthy company also is healthy thanks to the healthy of its employees. Do you think that it's a responsibility of employers to better cater for the medical care of their employees, in particular the care that's not reimbursed by Social Security? We can take the case of mental health, which is particularly relevant. We'll take another question. So to carry on from that question, as there are 2 insurers here on the round table, my question is access to health at work, and in particular mental health. Should we not modify and extend the responsibility of the company and by capillarity extend, significantly modify the insurance risk for the collective health of companies?
Catherine, so during COVID, there's an end of the dissociation of people. You are not an employee at 8 o'clock in the morning and etc. So the question of mental health is very complex because it covers the intersection of many dimensions. So people will react differently faced with a professional situation. So I will let my neighbor to answer that question, but there are lots of complex dimensions. So the professional branches should feel concerned, and they should be in a position to provide some answers. So regarding your question, I don't think that funding is not a matter for the company. This is the main principle of the insurance company: frequency and intensity. You need broad populations. There are some organizations, there are some bodies that can deal with that. These are the insurance companies. And then you have the branches, the key accounts. So it's a matter of organization. But if we were to take the matter only for companies, that's not enough. You need to take into account the economic fabric, the medium-sized companies. Paul, oh, if you consider the labor code, employees have a strong responsibility, a criminal responsibility. They have to protect the health of their employees. And all big companies pay due attention to that. It's a prerequisite. It's not enough, but they have to care for the protection of their employees. And when citizens, when people don't want to get no encompassing format. That's still the case in some countries, in some neighboring countries, in the UK, for example. If we don't want a single model from one company to another, there are some gaps, and these gaps can be justified by the funding capabilities of the company because they cannot fund social protection beyond what they can afford. But these gaps are justified by the working conditions, the professional situation of a professional branch. And this has to do with the solidarity, national solidarity, and the individual responsibility of people. And what is important is to well manage the health capital of people, the social fabric, the professional branches have a key role to play. We shouldn't accept something that is identical. It is not ideal to have a one-size-fits-all system. So solidarity is key. Confidence is key. The social bond is key. So we need some public systems whereby you can organize access to primary care, access to local care. Some of us think that regions should be more involved in order to manage access to primary care for those who are not covered by healthcare system. Paul?
I mean, there's a great answers, but as a large employer, I think we have to be a little bit more practical. You know, we have 100,000 people worldwide. We have 25,000 in France. And during the entire pandemic, 20,000 of our people went to work every day. They went to a manufacturing site to make essential medicines. They went to a laboratory to maintain an experiment, to create lung cancer products or breast cancer products. They never stopped. We had a first-line duty of care to make sure that their working conditions, the way they were controlled, and their opportunity to be socially distanced and perform, because society depended upon them, that we managed to achieve that. And we did that. And that was paramount. There is a responsibility, as you clearly say, that we take very seriously. But to do it in a pandemic was a double challenge. What emerged, though, in the Zoom world that we live in, was that the mental health component became much more of a challenge than anybody ever imagined. And for many people, they could fake that they were doing okay on a Zoom. Much more difficult in an office for 8 or 10 hours where your boss, a line manager, who was the first line of defense really in mental health, was saying, how are you doing? You don't seem yourself. Can I help you in any way? Can I introduce you to the company resources to help support you or get you outside help because you don't seem to be yourself? Many people in small apartments, we know this, really struggle. That's why we kept our offices open, so that people could go if they needed to just get to a bigger space and breathe. Going forward, I think this is a really important last comment to make. There's so much discussion about, will you go back to work 2 days a week, or 3 days a week, or 4 days a week? Will you be a hybrid? And everybody's asking the wrong question. It's a simple question. Why should you be back at work? What type of work will you do that is important that you are face-to-face? Innovation, brainstorming, team working, being together, eating together, watching after each other, and the new emerging corporate responsibility of caring about your people. You can't do that entirely remotely. You have to have some in-person to put an arm around each other and to make sure we're doing our best, because it's a problem when you go entirely remote and for long periods of time. I think we need to be much more focused on the new leadership capabilities that create skills and environments for people's mental wellness, happiness, development, everything else, to be able to still perform at a high level and still feel that human contact. We need to be careful we don't leave that behind with what comes next.
Thank you very much. Un petit mot de synthèse, j'ai trouvé.
So, very fruitful discussions. We didn't interact much. So what are the main messages? First message about public policies, long-term management regarding health management. This is something that is pivotal. This is one of the lessons that was drawn internationally. We need to pay heed to science. We can draw some lessons from the policies that have been conducted in different countries. Second point, local situation, the regional dimension. We haven't talked about the regional dimension much, but what about health and territories? I mean, health and territories are intermingled, an avenue for the future. Third point, the society of risks. There are new risks. These are not really new risks because health or mental health was already an issue in the past, but it is now emerging in a very acute way. What can be ensured as well, and caring for each other and facing each other. These are the messages of hope that we can deliver. I'd like to thank you all. I'd like to thank all the speakers. Thanks a lot.